been surprising to me our little clinics tonight.
All right. Sorry. And I always just go ahead and start their slideshow. She's ready to go.
Our last session, one of the things that was requested was information about after stroke, after aneurysm, after brain tumor, after any of these kinds of things. How does one get their rehabilitative needs met? What happens? What's that process? How do you go about it? What's involved in it? And so we invite Christina Tan to come and speak tonight. She's my favorite social worker. Big, large University of Kansas Hospital that has many, many social workers. She's very gracious to come and share this information. I find it very informative. Looking forward to hearing what Christina has to say. That tray of cookies back there was pretty full. I was hoping some of those would get eaten. Can I bring you back some cookies before we get started? Yes. Okay. I'm not going to trade in here. Also, I just want to remind everyone that to the left, right out this door, if you go out of those doors, is the women's restroom, and to the right is the men's. And so, we're going to prepare our flyer. Please make sure that you keep a copy of this so you know what's coming up. Next week, we're going to have Dr. Ebertol speaking about different coils. Next month, yes. I'm sorry. Thank you, Dave. Speaking about aneurysm clips and coils and pipelines. And we actually have videos of these things and how they're made. We'll break coils and show you about them. We'll have aneurysm clips and put those in your hand and let you look at those. The month after that, we will have Dr. Reeves, and he's going to be talking about the treatment after you've had your aneurysm or your ADM. How we care for you and anticoagulation therapy that we give patients. A lot of questions about that. And
Is there something besides rat poison?
yes, yes, he will talk to you about the various.
That's the opposite list, is coagulation.
And so, I'm going to go bring the cookies in here. Christina, you are welcome to kind of show me your first couple of slides while I show you that is on.
Perfect. Well, I am Christina Tan. I am a social worker at KU Medical Center. I've been there for about 7 years, and I've worked with the neurosurgery team for the last 5 years. So every day is a new learning experience in the world of medicine as a social worker, but I've really enjoyed it. I have also been involved in the ethics committee at the hospital, and I'm also a volunteer at the Brain Injury Association of Kansas and Greater Kansas City. And I also volunteer for Big Brothers Big Sisters on the side, not that that's related to brain injury, but that is something else that I dip my hands into. So my objectives today, yes, of course.
Volunteer at the Brain
Injury Association of Kansas and Greater Kansas City. And I'll have some more information regarding that organization later in the presentation. So you'll have contact numbers and those types of things. So I really want to be pretty informal. I want this to be what you guys want it to be. I have some information of what usually gets asked to me about rehabilitative needs and being in the hospital and what does insurance cover and what's the difference between Medicare and Medicaid and those types of things. So I have some information that I'm going to go over, but feel free to ask questions at any time because I really want to make sure this is geared to help you and I want this to be productive for you guys today. So we'll be talking about those various things, but I've also obviously left a big open because like I said, I want this to be for you guys. And I also would be interested in knowing how, as a social worker in the hospital, I can improve, things that you've learned through your process if you're a family member or a survivor of an aneurysm. And so how can we as a hospital be thinking differently to meet your needs while you're there? So when you come into the hospital, you have a lot going on. And so as a case manager, I have a part in that. And so really, I meet with families and the patient as early as possible. And so get an initial assessment of what's going on as far as medical, what can I be helping direct you to understand, because it is a whirlwind when you get hospitalized. So I do an initial assessment so you get to know me, I get to know you. Behind the scenes on a daily basis at KU Medical Center, I meet with the physician team twice daily to talk about what's going on and how to help make sure that you're getting that information. I also check out insurance verifications and start the process of trying to figure out if there's any insurance help that we can provide as a hospital. Continue throughout the time that somebody's in the hospital, monitoring progress and trying to come up with a good plan that we can recommend to the individual, and then really try to figure out how that meets the expectations of the individual with an aneurysm, and then beginning to do referral processes to different levels of rehabilitation. Different levels of rehabilitation include going home with some home health care. You have outpatient rehabilitation, day programs. There's skilled nursing facilities, inpatient rehab facilities, and then there are post-acute inpatient rehab facilities, which not many people know about. So after you go to a rehab at KU Medical Center, there are often specialized rehab centers that you can go to after that. Not a lot of people know about those because we don't have very many in the Kansas City area. Most that I'm familiar with are in the Nebraska area. And also, a lot of times, those aren't discussed because of benefits being exhausted throughout the process of rehabilitation. Is it okay for me to ask your experience with rehabilitation so that way I know a little bit more how to kind of guide this, the conversation of talking about the different rehab options?
Well, I had mine 9 years and 99, and there was no follow-up at all, I guess. I just sort of stumbled through it, tried to find what I could find.
So you didn't have a case manager help guide you through it? Okay.
I was not a KU.
Did you start out as an inpatient and with rehabilitation, or they send you home? Okay, inpatient. Okay. And then you kind of went through probably various phases of rehabilitation after that?
And it just doesn't sound, that sounds more formal than chaos. Bumping along from one thing to the next. First I went back to my yoga teacher, who also taught Tai Chi, and I had a stroke following the injury. Balance issues were definitely an issue. And I was fortunate enough to find an eye doctor, a neuro-ophthalmologist who knew about prism glasses. And I lost my vision in the years, or most of it. And that was a big deal. And I've talked to a lot of people since, and they didn't know anything about it. So I think what would have helped me the most is if people had dealt with me. Well, we have this option, and this option, and this option to help deal with your eyes, and we have this option, and this option to help deal with the lack of balance.
Yeah. And oftentimes it's probably hard to get one person to tell you all that information.
Of course.
I mean, even there is a lot more to rehabilitation than I even know, because I work in the acute inpatient side, and so there are resources that your outpatient social workers would know about, the ins and outs, and things that start to come up after being in the hospital that are more long-term or that are going to last a little bit longer, like vision and balance, and how do we address those. And so I'll talk about some different organizations that even maybe you can get connected with even after today to see if that may be helpful. So.
Well, for a while with this, I haven't had brain aneurysm, but last summer I started having problems with high blood pressure. I'm 55 now.
Sure.
So I started becoming aware of more things. So instead of ignoring a lot of that, I started paying attention. So,
Yeah, definitely.
so I'm here learning things. Even though I've had no trouble with it, I'm still here learning about it.
Sounds good.
And Kristen, I had a brain hemorrhage, and doing all the communication.
Sure.
And I'm sure that's what you do a lot of, is working with families, because a person with an injury is not really available for a lot of decision-making and planning.
Sure.
And I just think that if my daughter was here, she would probably be saying that the social worker was incredibly valuable in that process of sorting things out, because I needed to come home to Kansas City in the meantime, and so my family was, all my sisters and family were back here, my children are in Denver, and so coordinating that process of where was I going to do outpatient rehab, and then I had a pulmonary embolism and was back in the hospital 3 days after I got home. So 3 weeks in Denver, came home 3 days, back in the hospital for 10 days. And I do remember at that point talking with the social worker at St. Luke's South, and I really needed some information to clarify Medicare, because of course I had it, but I had an Advantage plan and had no plans on using any medical facility. I was bulletproof and I was going to be riding off into the sunset that way. But I remember that she wasn't helpful. She just wasn't, she didn't ask me what I knew about Medicare. She just said, you know, your Advantage plan has to do what regular Medicare would do, and I'm sitting there thinking, I don't know what regular Medicare would do, and I was really too embarrassed to ask. And at that point also, that whole concept of how to take a project and break it down, and what is it that I need to know, what are the steps? I mean, I was just doing baby steps, but still then.
Sure.
So, and I'm sure you know all those things about finding out what people do and don't know, and assisting in that information. But that would be the one thing I felt like she just didn't ask me questions and gave me some blanket statements and didn't supply some nitty-gritty information that I needed.
Yeah, I appreciate all of that information, because that's really helpful. You know, we all, as social workers, we get in and we talk about the similar things every day, and it's hard to sometimes stop and say, I'm explaining this for the first time for this person, and there are many variables and probably other things on your mind as we're talking about Medicare benefits or different things like that. And so it's good information to hear, and I'm sorry that there seem to be lacks in both of your situations. Do know that, you know, social workers, as I have found, try to be as helpful as possible. And so sometimes it's nice to go ahead and grab a contact number while you're in that situation, and then come back to it maybe a little bit later and follow up. You know, I particularly, and I will give you my cards today, is, you know, there may be things that come up after today that you have questions about, and I encourage you to call me or email me. And I do that with my patients in the hospital too, is I want to be there after the fact when you don't have a direct phone number to your doctor and say, I have these questions and they didn't get answered, and where can I be directed to?
And I just wonder if the social worker at St. Louis would say that she just was so busy and spread so thin that she was just doing this.
Sure, and I'm sure she was. But we still want to make sure that you get all of your questions addressed and get you to the right people. And it's hard. Medicare is a hard beast of an organization, and so is Medicaid, and it is hard to navigate. And I will never, ever in my lifetime know the ins and outs of the programs. And as they change with the Affordable Care Act, it just gets more complex. But, you know, we all have to navigate it together, and so it's just a learning.
Amazing service that we have.
Yeah.
It's just getting the right information.
Yeah, and the right person at the right time sometimes, it seems too. So. Well, some of the going through the levels of care, you know, I don't know if it would really be helpful for you to know, but, you know, I'll go through them a little bit quickly. Home health, as you may know, is when somebody comes into your home to provide nursing care or therapies. And the focus is to try to get you back to a level where you can transition to an outpatient program or just get that little bit of therapy that you need to be able to continue back with your day and your life. It's usually not as intensive because there are limitations to the therapists that can come out. So the therapists are driving from everybody's homes. You're not going to get as specialized therapies if you were going to an outpatient clinic because home, they're limited in what they can do. Insurance guidelines are usually very strict. They want you to be homebound, which is often hard. When you can be at home and you want to be returning to somewhat normal activity, but yet your insurance is saying you can't get therapies unless you're at home. And then a lot of times transportation is a difficulty to get to outpatient therapy. But usually 1 to 3 times a week, and usually people transition to outpatient after home health. So as I talked, outpatient is a little bit more complex and is going to be covered as an outpatient benefit, and it's arranged by a case manager. One of the things I didn't discuss, and I'll go back a little bit, is especially at KU Medical Center and a lot of the hospitals now, we partner with a nurse case manager. So you may be assigned to a social worker and a nurse case manager at the same time and not know it. And there may not be a social worker necessarily that meets with you, depending on that initial assessment that is done. A nurse case manager may be able to direct you to all the services that you need, and not knowing if you have any social work needs. But as a social worker, I also screen with my nurse to make sure that there's nothing that you can benefit from when somebody comes in to see me. Usually this is 3 to 5 times a week, so it's a little bit more frequent, which makes it a little bit more intensive as well. Day programs aren't discussed a lot. I don't know if anybody's ever heard of an outpatient day program. Rehab Institute on 36th and Main, and I believe St. Luke's on the Plaza are the only 2 in Kansas City that have day programs, which is an outpatient program where individuals go for intensive therapies between 4 to 6 hours a day. It's really geared to individuals who are trying to get back to work, trying to get back to school, and needing to get back used to that vocational type program. There is some nursing staff that are there to help with any of those types of needs, but mostly you are pretty independent with taking care of yourself, but needing to have that intensive therapy split up throughout the day. This is sometimes tricky with insurance to get covered, and I don't know if that's why there aren't that many. I mean, I definitely see the need on a regular basis for these types of programs. It's usually covered as an outpatient, but with getting 4 to 6 hours of therapy per day, some insurances consider each hour as 1 visit, and if you only get 60 visits per calendar year in your benefit plan, you can burn through those pretty quickly. Some things to know about insurances, depending on what you have, is even more so today, I've noticed that insurances are now assigning case managers to individuals. So if you have a Vantra Coventry Medicare plan or a specific, even probably an Amerigroup Medicaid plan, they're going to assign a case manager to you that can help you kind of navigate the system a little bit as far as trying to talk with the medical director at the insurance companies to try to see if you could maybe get a carve out for benefits. Now, that is sometimes a long shot, but it is still something that I've seen done depending on need. So even though insurance covers it differently and there may not be benefits, sometimes I've seen that you can get insurance to see the need, to see that's going to help in the recovery, to be able to get that covered.
That's a cost thing, insurance segment.
I think so, you know, just even today, I had an insurance company that had assigned a case manager, and she was working with me in the interest of the patient. And she was even trying to figure out if maybe the patient should get a different insurance plan and trying to help me navigate that. And that's not any interest of the insurance company that she worked for. But she was such a huge help and a huge advocate, and it was so nice to see. So I do see that, that those case managers are able to help navigate and advocate. And, you know, as a social worker working in a hospital, I can't talk to the medical director at the insurance level. But these case managers are in there, have those relationships with those medical directors to be able to really talk about how this person really needs this level of care or therapy. Skilled nursing is one of the 2 levels of rehabilitation that individuals usually go to after being in the hospital. Skilled nursing is the lower level of rehabilitation. It's usually for individuals who can't tolerate the 3 hours of therapy that are required to do an inpatient rehab program. It's in a nursing facility. Medicare covers it for the first 20 days at 100%. Oftentimes, individuals can go from skilled nursing facility level to an inpatient rehab. And so for individuals who have a significant injury that are not yet awake or not yet participating enough to really benefit from an aggressive therapy program, oftentimes the skilled nursing is a good place to start. Most insurances cover it except for Medicaid. Medicaid does not cover therapy in a skilled nursing facility. It will only cover either long-term care or a short-term stay in order to transition to an inpatient rehab. Insurance companies for Medicaid, though, will tell you that they do cover skilled nursing, but they do. Usually most skilled nursing facilities won't cover the therapy because they're not being reimbursed enough, which is a huge problem that many people are trying to address on different levels. But for right now, really the therapy is pretty limited. Acute inpatient rehab is your more aggressive program. Oftentimes people are surprised on how long they're in an inpatient rehab. They don't feel like they're there long enough. And so that's when, after acute rehab, you usually do your outpatient or your home health or a day program. The rehabilitation process does not stop after being in a hospital level facility like KU Med or St. Luke's or different hospitals that do have the inpatient. They have pretty strict insurance guidelines. You have to have some medical complexity that requires some continuing monitoring that you can't get on an outpatient basis. So if blood pressure is really high and uncontrolled, but you're ready to start your therapies, oftentimes that will qualify you for that medical complexity. And then obviously the more severe injury, the more complexities you have and the more labs that need to be drawn, those types of things. Then your subacute is going to be after an acute inpatient rehab, and it's kind of like a day program where it has the intensive therapies throughout the day. It's really goaled towards trying to get you back to school or work, really focusing on vocational training, but it is still inpatient, and so you still have that medical monitoring, and for some individuals that 24-hour care that you need to be able to continue getting better and recovering. Not a lot of insurances cover this because it is usually your benefits are up by the time you get to this level. And then the other hard part is the only one I'm aware of, or the only couple are in Lincoln or in Nebraska, and in Omaha, and I think there's one in Lincoln at Madonna. So there are very limited options for this level of care also, which make it difficult to sometimes get authorization depending on if your insurance goes out of state. But it is sometimes very useful for individuals. Does anybody have any questions about the different levels of rehabilitation? I don't know how much you guys are interested in knowing the difference between durable power of attorneys and guardianships. That's often a question that I get asked a lot about is, if a family member can't make a decision for themselves, well, I need to be that person. And so sometimes that's not possible, and we have to talk about guardianship. But oftentimes in the hospital, it just gets difficult because, you know, injury just happened 4 days ago, and we're talking about having to go to court and for me to be able to make decisions for my loved one. And so often at the hospital level, this kind of gets pushed to the side. We talk to your family members and help make those decisions, but these are often questions that come up for many family members. But basically, durable power of attorney is for you as a person to be able to appoint whoever you choose to make the best decision for you. And a guardian is when you cannot do that. If I was incapacitated and I was in a coma, I can't make the decision to appoint the durable power of attorney. And so oftentimes that has to be legally done by a judge. And that person can be a family member that's appointed, but sometimes that's also a person in the community that has volunteered to be a guardianship for someone. And then there's also payees within guardianship that do more of the financial decisions for individuals if they need that as well. Traumatic brain injury versus acquired injury. There are different programs that are available, and aneurysms in particular are considered an acquired brain injury because it happens by natural causes. A traumatic, even though having an aneurysm or hemorrhage is very traumatic and it's life-changing, and oftentimes it takes a very long time to recover, and that in itself is traumatic. A traumatic brain injury is considered something that has been caused by external forces. So gunshot wounds, motor vehicle crashes, if I fall and hit my head, those types of things are considered traumatic, versus an acquired brain injury, which is by natural means, so more of your strokes, your hemorrhages, brain tumor removals, those types of things. And I'll come back to why I've talked about those a little bit. But Kansas Medicaid has different programs that are available to individuals. Medicaid versus Medicare, I'll talk a little bit about. Medicaid is a state but sometimes federally funded program. So each state has its own program for Medicaid. In Kansas, we have it split up into 3 different providers. It's Amerigroup, Sunflower, and United Healthcare. Once you get Medicaid, they basically put you into one of those 3, or you can choose one of those 3. And each of the benefits are a little bit different, but mostly the same. Medicaid oftentimes covers nursing facility care, personal care services that Medicare doesn't cover. There are a couple waivers that are available in Kansas. There's a physical disability waiver and the traumatic brain injury waiver. Both of them are for individuals who are eligible for Medicaid between the ages of 16 and 64. And they are waivers that help with rehabilitation services, home and community-based services, and lots of other different services that an individual with either a traumatic brain injury would have, or in the case of an aneurysm or a hemorrhage, a physical disability waiver. Those categories would fall into the physical disability. Once you apply for these and get them, then you could be eligible for individuals to come into your home and do more of supportive services, nursing services, more of your what's considered home and community-based services, where somebody gets paid to come in and help you. The problem right now with that is there's a 3 to 4 year waiting list for those services. And so you are encouraged to apply and wait. And what a lot of people don't know is if you apply more than once because you're waiting and haven't heard anything, you start over again. So it's important to get on those waiting lists, but that makes it really difficult to come up with a good plan when you need it. And so oftentimes we have to rely on more inpatient settings for individuals until they can return home, which brings to money follows the person, which is Kansas trying to solve the issue of how do we get individuals back into their home and not have to wait 3 or 4 years to do that. So Money Follows the Person is something I know a little bit about, not a ton about, but basically in Missouri and Kansas, if you're in a nursing facility, hospital, or rehab for 6 months consecutively, you could be eligible for going home with services. The 2 agencies that help with getting you connected with Money Follows the Person are Community Works and Minds Matter. Those are just 2 that I am aware of, and I will have more information up there about those organizations. But this is oftentimes a hopeful solution to that waiting list. And being in the hospital does count towards that 6 months. Medicare, on the other hand, is a federal program, insurance program for people who are 65 or older or who have a disability. You have to have Social Security disability income for 2 years before you qualify for Medicare early. And you have to have worked in the past for a certain number of quarters in order to qualify still for Medicare. And then there are sometimes ways for you to get onto your spouse's Medicare if you haven't worked, or even sometimes for individuals who are a little bit younger, their parents' Medicare. I wish I knew a little bit more about that, but I don't. Then Medicare is split up into many different parts, but the most common are A, B, and D. A is more of your hospital coverage, your skilled nursing facility coverage, hospice, and home health. Your Part B is more of your outpatient type benefits that you would need. So your ambulance coverages, your medical equipment, outpatient therapy, outpatient appointments, those types of things. And then Part D is your prescription coverage. The important thing to know about Medicare and prescription coverage is if you do not sign up for it when you're eligible, they will penalize you on the back end. So individuals have told me that you could be charged about $30 to $40 more a month because you didn't sign up for it on the first initial time that they said you're eligible for Part D benefits. Would you like them? If you say no, you can be penalized for them. I think they're trying to change that at a governmental level, but right now that is a huge concern because people aren't paying for it because they can't afford it, but yet they're being penalized on the back end, and that just makes it much more difficult to afford medications. Some different supports in the community that you may or may not be aware of. United Way is a huge organization in Kansas City and other places, but from any phone you can call 211. And they will give you resources. You can say, I can't pay my utility bill this month and I need help, and they will let you know which organizations are helping with that. If you are needing some medical equipment, a cane, and you can't afford to go to the store and get a brand new one, or you want to see if one's been donated, they will let you know different organizations that are able, that have received donations. So they're a great resource that sometimes comes through. Usually early in the year, you get a little bit better luck on different financial assistance because individuals have the funds at the beginning of the year versus the end when they're starting to use all of their funds for the requests throughout the year. Community Works and Minds Matter are 2 organizations that help with the home and community-based services, getting connected with the Money Follows the Person program. They know a bunch about disability and trying to help get individuals back into their community and empower them and get them services to be able to live the lives that individuals want to live after having an injury and hospitalization. So they're 2 really good organizations to know and just even call if you have questions. So if you don't have that information, I'd be more than happy to send any of this to you. Turning Point, as you all know, is another huge support system, and so I'm glad to see that you guys know about them and are being connected with the services that they offer. And then the Brain Aneurysm Foundation is just another organization that you may be able to be interested in.
And Kristen, I think that that turning point has been a piece that's really an amazing piece that's available in our community. It's like a support group to keep getting good information,
Yeah,
moving forward. It's huge.
yeah, definitely. And it's nice to be able to, like the support group, connect everybody and be able to share information and share different support to be able to live your life every day and to have that.
And to have the structure that provides with so many different options of everything from movement to managing stress better to meditation, touching, all of that. I just considered it my job for a year and a half to go there.
Yeah.
And that was really helpful for me to have that structure and all of that support. When you walk in there and just like this group, it just feels like this connection.
I'm glad it's there too. I was so happy to know when Turning Point was started. And I'm glad to hear people are taking advantage of it too. Have you been to Turning Point before? No? Well, I'm excited for you.
What, you want to leave it? Yeah, we can back up.
Yeah. Yeah, the address is on the back there. And I think they probably can mail these out to you too if you wanted one, because they change each, every other month they change their calendar and they have different events, and I'm sure they take suggestions too on if there's something that you feel like might be helpful for you. I'm sure they have a suggestion box to be able to try to accomplish that too.
Are you on their mailing list, Dave? Because if you apply, you should be on their mailing list.
Must not be, so.
Okay. Check in with that if you want to get on it.
And then the Brain Injury Association of Kansas and Greater Kansas City is a really good organization that I don't know if a lot of people know about, but they have a survivor and family members seminar every year in Topeka and here in Kansas City where you can go, and they have presentations and speakers and different resources for survivors of brain injury. And they also provide other different resources. So I didn't put their phone number on here, but does everybody have internet access? Yeah. So if you get on their website, it'll give you the phone number, but usually the person that mans all the calls, her name is Amy, and she's great, at least at, if you call and say, I need this, she'll be able to help direct you through the brain injury community to help provide the resources or the help that you would need. And then they also have other information about support groups. So if you move and are wanting to know in Western Kansas what's available, they have a whole list of just different support information there for.
And do they have a support group of their own in the Greater Kansas City area, or
I believe
just do
so.
seminars?
No.
I think there is a brain injury support. I haven't found it to be well publicized. When we look up and we type in brain support Kansas City, what comes up is our support group website, which is brainsupportkansascity.org. You'll find that somewhere on here, right there. It's right in. So we checked that out. I don't know, unless some other way.
Yeah, I haven't looked at it in a while because we have one at KU Med that I usually provide to individuals there. But I'd be more than happy to even look it up before we leave today. If you guys are interested in knowing where that would be. Yeah, and there is a section for, I forget, I'd have to look it up, but I can walk you guys through it and show you. Yeah. So, and it's hard because there's brain injury, and then you've got traumatic brain injury, and then there's just different options to look up. It's sometimes hard just to figure out what's the right keyword that they're trying to talk about. So that's all my information that I prepared. So I don't know if you have questions for me as a social worker or working in the hospital or anything. I'm willing to answer any questions that you guys have. I just put some up there, that I thought maybe would strike some conversation depending on individuals, but it's helpful to know what would have been, what you wish you would have known, and you've shared some of that, and you've shared some of what wasn't provided, and so there's often those missing pieces, and whether it's because family was talking with the social worker and forgot about what was said, or the social worker didn't meet with somebody, it's hard to get connected to all of the resources at once when you have an injury you weren't expecting, and it's scary, and it's fast-paced, and you have a million people coming in and out every day, and you're not getting rest, and
Most of us don't know that's happening.
Well, any given day with any given thing. If we don't know what we don't know.
Yeah.
We don't know. So it's an inherent process, particularly if something is happening with your brain, organ which you know things. Challenging. It's crazy. It is brutal. It is sensitive a lot more than I really understood. It's complicated.
Yeah. So one of the things that I was aware of, and I was feeling like I wasn't in control of the vehicle anymore. That everybody was talking to each other and to the professionals, but there were some things being decided without talking to me. And there was good reason why I wasn't being talked to, or there was just too much to know and too much to, but at the same time, if there's a way to keep the patient in the loop of conveying that sense of, you can't pretend they are in control because they're not, but just as much as you can to convey to them that they're part of the loop of things and they're included in the loop of things being discussed in the decision making. And it's pretty hard to say to somebody with a pretty serious head injury, and we'll be including you in the decision making, and we certainly want to hear what you have to say. But I just remember saying to my sisters and my daughter, guys, I am going to be the decider here, and I need to be talked to directly rather than everybody talking about me outside of me having a say. I'm not saying this very well.
No, you are. I mean, you're saying this happened to me, and I want to know, and that it is so important for everybody that wants to be involved in decisions to be involved, but it is so important for the person that has lost the control to be in that and know what's going to be ahead of them. And so sometimes it does get limited because it is overwhelming, and being able to have that emotional regulation sometimes is hard, and it's trying to walk that fine line. But I agree with you that you have to be a part of it, unless you are just 100% not able to.
Yeah, unless you're in a coma, there's got to be some way that
you have to. Yeah, no. And it's nice when you have individuals in your family that you trust, that you can say, hey, I'm the decision maker here. And so I hope that was your experience where you were able to trust those individuals.
And I did very much. And as an responsible oldest of 6 kids, it was just so important for me to retain some control of my life, because this is a time when everything feels totally out of control, because when did we ever think this was going to happen to us? No, not at all.
hardest part sometimes is being able to have everybody on the team understand that. You know, you may have nurses that understand and are every day making sure that you're updated, but it's good for providers to hear this information and remind us that this is not every day for you. And you don't know what every day now is going to look like. And sometimes it's hard to get everybody on a provider team just to sit down and say, okay, we've got to make sure that everybody understands, especially you, when at the very beginning, when the injury first starts and you're not able to even make decisions, we go to the family. And so it's kind of also getting that whole team to refocus that, okay, now we went to the family, but we got to regroup back and make a circle and make sure we're all understanding and all on the same page.
And it was so important for me to believe that I could still process, that I could still be in control. So there's that balance between what's realistic and what's not.
Yeah.
But there's a way to convey that belief that this is going to get better.
Yeah.
Or who needs to know.
Yeah.
I understand that you all need to make decisions, but you gotta remember, this is my life, and I'm gonna have to be living it. So, I have to have something that, you put into it at some level. Even if it's confused. My son used to walk me through the hospital and make me add or subtract or multiply the numbers of the rooms because I couldn't do any math at all. And oddly enough, that was very helpful. I didn't like it, but it was helpful.
That was amazing. My brain wasn't ready to do anything.
Yeah. No, and then he was also funny, he said, I said, I wanna go home now. He said, well, who's gonna mow the lawns? And I said, I am. I always have, I know. He said, Mom, you don't have any idea what's happening, do you? You know,
Because your life just gets turned around. It's 180.
Yeah. well, of course I can go home and do it, it'll be silly.
I was in Denver because I was nannying for my 2-year-old grandson. And school was gonna start, and I was in the hospital in intensive care, and I was saying, well, you've got to start school next week. My daughter works for a school system as well. And I said, so I've got to get out of here.
No.
And my daughter looked at me and said, Mom, nannying is off the table for right now. Your job is to heal, and we're just working with you on a plan where that's best to have happen. That was so hard to hear.
I'm sure it was hard because you didn't have that time now with your grandson.
Yeah. And whether it's mowing the grass or following through on the plan that we have.
My boss kept coming. He was encouraged because I was setting goals. I'm not a person who likes to think like that. I made myself a goal list and thought that was very encouraging. Maybe.
And I think that would be, you're seeing your life going forward and getting your ducks in a row to make it go forward.
Are there organizations that you know about other than Turning Point that have helped you continue in your recovery every day and navigating questions that you have or have had in the past?
Well, I see this work group as part of Turning Point. Do you consider yourself part of Turning Point, Nancy?
You were very supportive of Turning Point.
But,
We are our own thing.
okay, and so so I would say this KU support.
And can you, how long to manage his tree? KU. So we're both kind of supporters that alternate KU.
Well, I think the information.
You guys are really interested, Becky, sharing everything with us and all your knowledge and experience.
I'll grab my cards for you guys. Are you interested in me looking up the Brain Injury Association to see if they have a support group?
I mean, I can do that,
Okay.
and I think probably, well, I can see if I can put that would be, in addition to this. Or if this is enough.
I'll just bring it up so you at least can see what it looks like. There are different brain injury associations. So sometimes it's hard to find the right one, but I don't know if our internet's gonna work. And feel free to take any more of those turning point brochures if you have friends or anybody that would want to have any.
And do you see this as more TBI versus acute brain injury?
You know, traumatic brain injury, especially for the Brain Injury Association, is something that they do focus on. There was a woman named Amy Thompson that had a traumatic brain injury, and she had died, and so her family still has a run, and they do a lot of sponsoring with the Brain Injury Association because of that tie.
And so people with stroke can be part of this as well?
Yeah, so this is any brain injury. This is stroke, this is an aneurysm, this is having a brain tumor removed. They have they really can provide any type of support. Let's see, so you can go to the support groups section, and then it'll pull up where you can search. So let's see what would be the best way to do this. Will be northeast or northwest? Northeast, we're in Kansas, yeah. Sorry, I'm a Missourian, so I get confused. So Kansas, they have one in Kansas City, Kansas, the second Tuesday of every month, which would coincide, I think, with this one. But this one's from 4:30 to 5:30, where ours here is from 6 to 7. And this is actually, yeah, this is actually at KU Med. And it's, I want to say, yeah, so in the hospital at KU Medical Center, and the cafeteria, they have a wind-out room. And that is where it is at. And they have typically focused more, if you are interested in this one, you may want to call, because they typically have been more traumatic brain injury versus stroke and those types of things. So, but I know they've been refocusing it because of needs. So it may be something you'd call about before, because I would want it to be fitting for you guys.
There's what?
A park?
The parking.
Oh, I know.
How fun is that?
So, but there are different locations, so.
How big this city is, I guess.
Let's see what Missouri.
That place gets bigger all the time.
Yeah. Well, and they're building onto their neurological side of things too, so.
Kristen, I am meeting with a young woman whose father had a stroke, and she got my name from a good friend of mine because I had had a stroke, and she would have thought this presentation tonight was fantastic. Could you call her if she has any questions?
Yeah. Okay. And we do have let's see, we have a support group for stroke. And we have an aphasia group at KMed. Nancy, do you know if we have a specific stroke, or does Janice do an actual stroke support group, or does she do any aphasia?
The National Stroke Society, the Kansas City Stroke. I asked her, they were, is what she told me,
Okay.
18 months or so.
Yeah, but if you are interested, I mean, either if you want to know if there is one at K, you can always email me, or feel free to have your friend
Okay.
already. I don't always have the answer, I won't promise that, but I at least can help guide you the best of my ability.
Thank you.
Yeah, of course.
This is Dave so nice to meet you.
Just read it, that, maybe see it wrong.
Yes.
Do you have any other questions? Did I hear that you were a social worker? Are a social worker?
Yeah, I think it was up to slow and microphone.
You are, yes. Social worker owns my heart.
Yeah.
Or mine. Actually, were you gonna ask something? I interrupted you.
No, not at all. Just got out of it, but I thought it might help her. She got back in that front.
What happened was,
So you know more about that than I do.
Yeah.
my license came up through the law in the hospital. So I had to go through all of it again. Get reinstated. No, I don't take tests.
Okay. Well, I think social work is one of those things where you can know a lot about a lot of things, or you can specialize in something that you may know enough about to be helpful. And there are many organizations, I'm sure, that would love to have your experiences and your stories, and also that social side of things. It's nice to have
I'm
that.
gonna do it full time.
that outlet.
I'm gonna do it full time.
How long ago was your injury?
99.
I don't even know if I agree that math, so. 16, yeah. Seems like yeah.
And so much of what happens afterwards, okay, it helps you to talk structures the way so that happens. Too much would just seem random. I was is no. Lenora and with the patient. Rehab and everybody else was learning to use a wheelchair. I was a little frustrated. I was not learning. So she said, I think you're gonna be a walker. And I said, my next students. No, sure.
It's hard sometimes since there's so much going on, you don't get to hear about the smart doc processes.
Yeah.
What really is happening and you don't think is happening. There's so much that I do that probably, and I don't necessarily see it to everybody every day, but there's so much that I do behind the scenes that I'm still working on. That sometimes I even forget that people don't realize that it's happening. So people think I forget about them, but you know, they're not. You're just coming up with a good plan.
Yeah. And I'm amazed how it's so concerned with events, activities are free. And I made a claim with
KU Med. After I got my undergraduate degree and started working with KU Med and doing my master's and never left.
Springfield, you can say.
Well, I haven't decided. I haven't really declared fully.
Yeah.
I'm Missouri side still, so it's hard for me to root for Jayhawks because for a long time everybody was always talking about Columbia. My siblings
Right.
go
Oh,
to
you go to school, was it that Columbia then?
No. But I went to UMKC for my master's.
Okay,
So I'm still like all Missouri side.
Okay.
So.
Yeah, I'm sorry, I was just thinking of Lawrence,
Yeah. Yeah.
being the king, that's our,
One more, I just haven't prepared the one priority, the sports team. I've always had friends that have been Mizzou fans, and so I've always kind of stayed on the line. Root for the underdog of the game. So it's usually basketball is usually Mizzou, and football is usually Jayhawks.
Used to the system's unlawful and
Thank you. It's nice meeting you guys.
Nice meeting you, for sure.
Glad you guys were able to come.
Yeah, so are we.
Take advantage. Nancy's got some great stuff coming up.
Okay.
It's on that list of for people. So interesting information. I think next month sounds really cool. Just being able to hear about all the different surgeries and coils and all of that.
Coils?
Yeah. So they do coiling of the aneurysms.
yeah.
And clippings of the aneurysms.
Yeah.
So we're bringing, sounds like the different parts of everything.
Mine was primitive, they did a metal clip, so I can't
I don't think they use metal clips anymore.
Well, that's what they told me.
Yeah, I don't know.
Oh, yeah, that back is holes.
Yeah, I can imagine.
Well, when I was in hospital, at one time, the nurse was found to determine I was gonna get on my gurney and go have an MRI. I suspected found to determine my wild type.
Oh, yeah.
And I'm real surprised the nurses have ready to send.
Oh.
I'm here to pack this, she left from there and she killed somebody.
Well, what they didn't know was they said, I said I have a metal clip, she said, no, you don't. I said,
Yeah,
we
it's
only
killed
use
this one.
plastic.
Jobs, you know, got to do it and work.
And I thought, just please go look it up, please. And don't try to make me get on that gurney, 'cause I'm not getting on it.
I'll read your first and read it.
Oh,